Miss Fabiola. I'm
Hello.
going to be your nurse for today.
Okay.
Alright, I'm going to go ahead and write my name up on the board just in case you need anything.
Okay.
Alright, I'm going to just close these up just to give you a little bit of privacy. Alright, and then just to confirm, can I get your full name and date of birth, and I'll check your bracelet name.
Darlene Arias, 11/04/1988.
Perfect, thank you, Darlene. Then just to confirm, Darlene, do you have any allergies?
No allergies.
Okay, how about any pain today?
No pain.
Okay, great. And then it looks like our CNA took your vitals. Everything was stable. Blood pressure 108 over 74, heart rate 70, respirations 18, O2 99% at room air.
Okay.
Okay, so we're going to go ahead and do a head-to-toe assessment, but I'm going to start off by just assessing orientation. So if you can tell me where you are and why you're here.
I am at home and I'm here for a physical assessment.
Great. And then what day of the week is it?
Today is Monday.
And who is our president?
Joe Biden.
Okay. And then how's your mood today, Darlene? How are you feeling?
Pretty good.
Okay.
Good.
All right, Jillian, so we'll start with the top, the scalp. I'm just going to assess for skin integrity, make sure color, temperature, and then I'll go ahead and palpate, make sure there's no lumps, bumps, or bruises. Any pain while I'm doing this?
No.
All right. Your hair is actually equally distributed. I didn't feel any lumps, bumps, or bruises, so that's really good. We'll move forward, and I will check your ears, okay?
Okay.
So I'm going to do your right ear. I'm going to pull up and back, make sure there's no drainage, any redness, excessive cerumen. That looks good.
Okay.
Move on to the left ear, pull up and back, no drainage, excessive cerumen, no redness. That actually looks good.
Okay.
We're gonna move on to your nose. I'm actually gonna just push up a little bit, make sure that there's no polyps. Everything looks clear. All right. We're going to move on to your mouth. We're going to go ahead and open wide. I'm going to check that your uvula is midline. Good dentition. Stick your tongue out. Okay. Say ah. Okay, that looks good. And then we'll move on to the next portion of the exam. I'm going to go ahead and just check for your carotid arteries. Okay. Easily palpable. And then I'm just going to assess that there is no bruise.
Okay.
With the bell of my stethoscope. Okay, and then I'm just going to compare. Make sure there's no deficiencies. Okay, that actually sounds good. Easily palpable, no bruise were noted, everything sounds good. We're going to move on to your lymph nodes. I'm going to go ahead and just palpate. Okay, no lymph nodes palpated. I'm going to check your preauricular, postauricular, submandibular, submandibular, supraclavicular, and I'm going to just make sure that your trachea is midline and your thyroid is there. Go ahead and swallow. Perfect. And then lastly, we're going to check for jugular vein distension. You're going to go look to your left so I can see your neck. Great. And then look to your right. Awesome. No JVD. So now we're going to move on to the portion of your cranial nerves. First one, we're going to test cranial nerve number 1. I'm going to have you actually taste your olfactory, your sense of smell. Go ahead and close your eyes and then cover one nostril. I'm going to put something up against your nose. Take a whiff and let me know what you smell.
Cinnamon.
Great. Now let's switch nostrils to the other one. Take a whiff.
Vanilla.
Perfect. Number 1 is intact. Go ahead and open your eyes. Number 2 looks, we would do with the Snellen chart. Check for your vision. Looks like the CNA did it. 20 out of 20. Great.
Okay.
Just a double check. If you can read my name off the board.
Fabiola.
Great. Now we're going to move on to cranial nerve number 3, 4, and 6. We're going to do the Perla test. So I'm going to flash my light. I'm going to check for reaction and accommodation. So I'm going to flash this on your left eye. Great. Pupil constriction is great. Your right eye. Pupil constriction is great. And then just kind of follow my pen. Okay. Awesome. So your eyes are Perla, their pupils are equal, round, reactive to light, and accommodation. So we'll move on to cranial nerves number 5 and 7. So I'm going to check your trigeminal nerve. I'm going to check certain parts of your face, okay?
Okay.
Say yes if you feel this.
Yes. Yes. And yes.
Okay. And then go ahead and close your eyes. Let me know if it feels rough or smooth.
Smooth, smooth, and smooth. rough, rough, and rough.
Okay, great. So 5 and 7 are intact, but lastly, I'm gonna have you puff your cheeks. Okay, copy me. Do this with your tongue. Close your eyes. I'm just gonna, okay. And then lift your eyebrows. Perfect. 5 and 7 are great. And now we're gonna move on to cranial nerve number 11 because you're already laying down. Your trapezius. I'm just gonna put some resistance and shrug your shoulders. Awesome. Now we're gonna do cranial nerve number 9, 10, and 12. So go ahead and open your mouth. Stick your tongue out. Okay, enough gesticulations. And we're gonna quickly test your gag reflex lightly. Okay, they are intact. And then lastly, I'm gonna check 8. So we're gonna check the Romberg test and the whisper test. Go ahead and stand up.
Oh.
I'm gonna stand behind you. I'm gonna whisper a few letters or numbers and just go ahead and repeat.
Okay. 27.
Okay.
18.
18. Perfect. We're going to do the Romberg test. Make sure that you have good proprioception. Make sure that there's no dizziness. So go ahead and close your eyes.
Okay.
And extend arms in front of you. Now to the side. Okay, we have a negative Romberg. But while you're at it, go ahead and take 2 steps forward. We're going to check for gait and balance. Great. Perfect. Okay, and then go ahead and have a seat. Alright, you can just go ahead and lay down. We're going to continue with the rest of the exam. We're going to continue with the upper part of the exam, the portion. Can I go ahead and disrobe?
Yes.
Okay, so I'm going to just check. Let me know if you can feel this.
Yeah.
Okay, we're going to do a little grip test. Squeeze, okay, and go like this. Alright, some resistance. Perfect. Skin integrity, looks, everything's normal. Warm to touch. I don't see any bruising or ecchymosis. Everything sounds good. Okay. And we're going to move on to the next portion, which is your heart and lung sounds. But for that, I'll have you sit up because it'll be a little bit easier for me. For your heart sounds, we're going to start off with your apical, second intercostal. Pulmonic, second intercostal. Tricuspid. And then mitral, fifth intercostal. And then we're going to do Erb's point, third intercostal. And then we're going to listen to apical pulse for 60 seconds. Okay. Now we're going to move on for your lung sounds. We're going to have 6 anterior in the front, 8 posterior, and then I'm listening to the sides, okay?
Okay.
And then just go ahead and take deep breaths when my the diaphragm of my stethoscope touches your chest.
Okay.
Deep breaths. Okay, now we're going to check your lateral lung sounds. So go ahead and actually come a little this way.
Oh, sorry.
Raise your arms, and I'm going to check the upper and lower lobes. Okay. Deep breaths. Okay. And go ahead and turn this way. Excuse me. Oh, go ahead and sit up. I'm going to do your posterior lung sounds. Okay, deep breaths. And then right below the scapula for your lower lobes. Okay, perfect. One thing that I did forget to do is check for your deep tendon reflexes. So while we're at it, we're going to check your biceps, triceps, and brachioradialis.
Okay.
Okay. I'm going to use my deep tendon reflex. Okay. Okay, I saw that move. And then we're going to do this one here. And then kind of like a pitcher, do that. Have it swing a little bit, relax it. Okay, perfect. All right, now we did the heart and lungs. We're going to do the abdominals. Just kind of lay down a little bit more. All right, we're going to just lift up a little bit. I'm gonna go ahead and inspect skin integrity. Everything looks even, no ascites. I don't see any visible lumps, bumps, any hernias. And then I'm gonna go ahead and auscultate using the stethoscope. We're gonna start with the right lower quadrant, and I'm gonna work my way in a clockwise manner.
Okay.
Right lower, right upper, left upper, left lower. We're gonna listen for any bruise. Okay. No bruise noted. We're gonna percuss now. Okay, same manner. Right lower. Okay. Right upper. Left upper. Left lower. Okay. We heard tympany. Then lastly, I'm just gonna palpate with the finger pads of my fingers. Right lower. Let me know if you feel any pain. Okay. Okay, no bumps, no hernias, nothing. Okay? All right, and then moving on from there, we're going to go to the lower extremities. Let me know if you feel this.
Yeah.
Okay. We're going to check your pedal pulses, capillary refills. The same for your fingers. Okay. And then aside from that, I'm going to do your patellar reflex. I didn't see any edema. Skin was warm to touch. Your reflexes were good. And then go ahead and sit up. Okay. Once again, we're going to do the little percussion hammer. I'm just going to take for your patellar reflex, okay?
Okay.
Okay, great. Everything was pretty normal. Do you have any questions?
No, I don't think so.
Okay. All right, I'll go ahead and give my assessment to your provider, and they should be here with you shortly, okay?
Okay. Thank you so much.